Hi everybody, it is Miss Rachel again with iCode Academy. Today I'm going to be talking to you about inpatient versus outpatient coding. So let's get started here. Here we go. So as you get into coding, you're going to be hearing a lot the terminology inpatient and outpatient. So what I want to do with you guys today is really talk about what that means to you as a coder, as well as just giving you kind of a general overview of those services. So here you can see that we're going to start off with inpatient, and our inpatient settings can widely vary depending on the type of care the patient's needing. So obviously the type of settings that have the most care are going to be your acute care hospitals, your large hospitals that do everything from deliveries, major surgeries, ICUs. Those are going to be your acute care type of inpatient settings. Moving on down the line, we also then have specialty hospitals, perhaps a children's hospital or a hospital that specializes in orthopedic procedures, for example. Then we have rehabilitation hospitals, and moving on down the line to ones that require the least amount of oversight for the patient, but still qualify as an inpatient care, is going to really be like your skilled nursing facilities. These are just a couple examples of inpatient settings, and by any means is not an all-encompassing, one and done kind of list. All right. Like I alluded to earlier, your inpatient settings are really going to be the type of facilities that are doing your complex surgeries, serious medical conditions that need constant monitoring, such as your ICUs, or somebody who's receiving management of maybe chronic kidney disease or those type of conditions. You can also be admitted to an inpatient facility for procedures, delivering a baby, different psychiatric conditions, maybe substance abuse or severe injuries that need ongoing rehabilitation. So those are just some of the services that you may see or may be coding for when it comes to an inpatient setting. So let's talk about outpatient. Outpatient settings are ones that we've all been involved in, whether it's from, dealing with a family member or going there ourselves for care. These are going to be your quote unquote clinical visits where you're going in, you're checking into the facility, you're having an appointment at a specific time, and then you're leaving. You're not spending the night and you're not staying at the facility. Some of the services that might be rendered and thus coded with these outpatient facilities could be anything from x-rays, blood work, minor procedures, including colonoscopies or mammograms. You might be receiving consultations or routine follow-ups, as well as annual examinations. And some outpatient facilities specialize also in dialysis, chemotherapy, or various types of radiation treatments for their patients. So let's talk about how this is going to impact you at the end of the day as a coder. That's really what we want to be focusing and what we want to know. Oops, sorry, got a little ahead of myself there. So as a coder, the first thing I want to stress to you is you need to be aware or understand if you're coding for an inpatient facility or an outpatient facility, because starting off right away, you're going to be using different coding manuals, so your coding books. On the inpatient side, we are going to start off with our ICD-10-CM for our diagnoses. Our procedures are going to be using the ICD-10-PCS. So these are going to be your two go-to manuals when it comes to the inpatient setting. The outpatient setting is also going to use our ICD-10-CM when it comes to diagnoses codings. So you can see there's no difference there. Same manual for diagnoses across the board. The difference is on the outpatient side, you're going to be using your HCPCS Level 2 as well as your CPT book. Those two in conjunction are going to be used when it comes to capturing the codes that you need for procedures in an outpatient setting. All right, so let's talk about some more differences between inpatient and outpatient. Now, inpatient coding, again, these are your acute care hospitals. These are the types of organizations or facilities where patients are there for more than a specific amount of time or a scheduled appointment. They might be there for 2 days. They might be there for several months. This is going to, again, be related to the extended stay of the service. And so when you're doing inpatient coding, you want to make sure you're aware of the rules or the guidelines that relate to inpatient coding. And what I mean by that is they may be running a wide variety of tests, making changes to the treatment and the diagnoses, potentially on a daily basis. And so these lengthy stays can result in extensive as well as very detailed patient records. And typically an experienced medical coder is going to be the one that's doing the coding within an inpatient setting. Now, if it's outpatient, whether it's, a scheduled clinical encounter or maybe even an ER visit, you're going through, and the patient has certain tests, maybe certain procedures. They have a diagnosis at the end of that final encounter. And so even if the patient is there, maybe perhaps overnight, or into the evening, such as an ER visit, they are still considered outpatient because they're not being admitted for ongoing care to the facility. And so with our outpatient coding, specifically when it comes to our diagnoses, the general rule of thumb is this is a direct treatment that's offered, typically less than 24 hours. We want to make sure that for our outpatient coding encounters, for diagnoses, that we are noting the definitive or the final diagnoses that are reflected in the assessment and plan. And I'll compare those differences with you in a little bit here. For your inpatient admissions, whether it's a short-term, long-term, acute care, or maybe perhaps even a psychiatric hospital, uncertain diagnoses at the time of discharge should be coded. And what I mean by that is maybe they still need to do some follow-up. Maybe they believe that this is a specific condition, like community-acquired pneumonia. The provider may document within their note this is a possible or suspected diagnosis. Inpatient coding, we still need to make sure that we're picking up those suspected, probable, or possible diagnoses. Inpatient side, we don't want to do that. Outpatient. Outpatient side is your final definitive diagnoses that we're going to pick up and code as within the chart. All right. Moving on, let's look at the next one. So everything that I kind of just went through in my little verbal spiel, let's focus on how that impacts you as a coder. Again, your inpatient coders are going to review the entire medical record for the whole stay, looking for your principal diagnoses and secondary diagnoses for the existing conditions. Outpatient coders are focusing on one particular data service. They're going to select the first listed diagnoses code and then any secondary diagnoses. But again, please keep in mind the difference between what type of diagnoses we're picking up in inpatient and outpatient. Again, your inpatient is where you can pick up unconfirmed or not finalized diagnoses. In outpatient, we can't do that. And so you can see that here when we talk about coding for signs and symptoms. Inpatient, go ahead and pick up those suspected, probable diagnoses that are reflected at the time of discharge. We don't want to be picking those up on a day-to-day basis in our daily cares or our subsequent progress notes because they may be ruled out through further on testing. But we can go ahead and pick those up at the time of discharge when the patient is ready to go home. If the assessment and plan or the provider's documentation says, suspected substance abuse or a possible chronic kidney disease, then we can go ahead and pick those up. However, for the outpatient side, we cannot pick up those suspected or probable conditions. One thing I would suggest reviewing is within your diagnoses manual, let's review Chapter 18. That's going to give you a little bit more insight if needed on that topic as far as coding for signs and symptoms. All right, let's talk about guidelines. ICD-10 is going to offer additional guidance in the form of exclusions, code first, and inclusion notes that are always going to direct you to the correct and appropriate code. So when there is no diagnosis that has been established for an encounter, what we want to do is code for the condition or the conditions with the highest degree of certainty. This may be signs or symptoms as well as abnormal test results that resulted for the reason of the visit. If our signs and symptoms are associated routinely with a disease process, then we want to go ahead and assign codes for them unless otherwise instructed by the classification. So as a coder, this is where you always need to make sure that we're reading the parentheticals, such as our exclusion, our inclusion notes below the code descriptions. Now, if signs and symptoms are not associated routinely with a disease or a condition, we want to go ahead and code for them. So what I mean by that, taking it back a little step here, is if a patient is coming in and they are diagnosed with pneumonia, one of their signs might be a fever or a cough. Well, a cough and a fever goes hand in hand. It works with, it's a part of the disease process for pneumonia. So we're going to code for the pneumonia. We're not going to code for the cough or the fever. But if the patient has that final diagnosis of pneumonia, but they're also having blood in their stools, those two don't correlate with each other. So you want to go ahead and pick up the blood in the stools diagnoses with the pneumonia, because the two of them are not interlinked or related in any way, shape, or form. So let's take a look here at a little visual guide, if you will, as far as the difference between outpatient coding and inpatient. So again, outpatient is typically less than a 24-hour stay, while inpatient could be more than 24 hours, typically overnight, up to several months or years, whatever the patient needs. There is no order that is needed for outpatient, but a physician order is needed to admit a patient from either an ER to an inpatient status or from outpatient to inpatient. So we do need that order within the documentation. Next, we have our outpatient, which is, really a wide variety of physical locations, and that correlates exactly the same over to the inpatient side. Your outpatient is going to, again, have a scheduled visit, so you have an appointment with Dr. James at 10 a.m. on Tuesday. Your inpatient encounters are going to reflect an admission report or an H&P as well as a discharge. And this is where we have that ongoing provider oversight, as well as POA or present on admission indicators. So those POA indicators, as a reminder, is going to be if a patient is diagnosed with pneumonia. Did they acquire that pneumonia while in the hospital, or was that present when they were admitted? We want to make sure that we are documenting and adding those POA indicators appropriately. For both inpatient and outpatient, we're going to be using our ICD-10 CM manual for the diagnosis coding, but the big difference is going to be where we're doing our procedural coding. Outpatient side, you're going to have two manuals, CPT and HCPCS, and inpatient is going to be the ICD-10 PCS manual. Outpatient, we are not allowed to code for suspected, probable, likely, or possible conditions, but we can go ahead and do that on the inpatient side. And last but not least, our outpatient, the codes are based on that specific encounter or visit, and the inpatient codes are going to be based on the entire length of the stay. That's all I have for you guys today on the difference between inpatient and outpatient coding. Please tune into my other videos if you have any other questions. Thanks, guys. I'll see you later. Bye-bye.